When it comes to protecting your heart and supporting healthy circulation, most people have heard of aspirin, the age-old over-the-counter blood thinner. But a lesser-known player is gaining traction in the natural health world, nattokinase. So which one is better for you? Let's break it down. Aspirin is a synthetic drug used for over a century. It reduces pain, inflammation, and most importantly for heart health prevents platelets from clumping together, lowering the risk of blood clots that can lead to heart attacks or strokes. Nattokinase is an enzyme derived from natto, a traditional Japanese food made from fermented soybeans. It has fibrinolytic properties, meaning it helps break down fibrin, the protein involved in clot formation. In simple terms, it helps your blood flow more freely, naturally. Aspirin is proven to reduce risk of a second heart attack or stroke. Recommended by doctors worldwide for secondary prevention. Works by inhibiting COX-1, reducing platelet aggregation, stickiness. Nattokinase works differently than medications. While aspirin simply thins the blood, nattokinase actively dissolves existing clots and prevents new ones from forming. It offers a rare combination of properties. Nattokinase dissolves blood clots effectively, rivaling pharmaceutical agents like plasmin and heparin, without the bleeding risks. It reduces arterial plaque and improves lipid profiles, potentially outperforming statins in human studies. Nattokinase reduces blood pressure in both prehypertensive and hypertensive patients. Also reduces platelet aggregation and promotes blood flow, comparable to low-dose aspirin but without gastrointestinal complications. Aspirin is backed by decades of clinical trials, especially for patients with a history of heart disease. Nattokinase is supported by smaller human and animal studies suggesting benefits like reduced blood pressure, improved blood viscosity, breakdown of clots. In rats, nattokinase dissolved 88% of blood clots within 6 hours, and in humans, a single 2,000 fibrinolytic units oral dose significantly increased fibrinolytic activity within 4 hours. Over a 26-week period, nattokinase reduced carotid artery plaque thickness more effectively than simvastatin. Nattokinase significantly decreased blood pressure, triglycerides, LDL cholesterol, and increased HDL levels. In stroke patients, it demonstrated neuroprotective effects, reducing infarct size and inflammation. Despite its enzymatic complexity, nattokinase is orally bioactive, an unusual and valuable trait. It's also cost-effective, widely available as a supplement, and generally well-tolerated. Which one should you take? Choose aspirin if you've had a heart attack or stroke. Your doctor recommends it for secondary prevention. Choose nattokinase if you're looking for natural cardiovascular support or you want to improve circulation and blood flow without synthetic drugs. If you're already on blood thinners, taking either without medical supervision could be dangerous. So it's not either or it's about you. Aspirin and nattokinase serve similar purposes, but they operate through different mechanisms. One is pharmaceutical, the other nutraceutical. Your choice should depend on your health status, risk factors, and goals. If you're leaning toward nattokinase, look for a brand that includes at least 2,000 fibrinolytic units per dose. This dose is reported to not cause adverse effects by the European Food Safety Authority. Limited research using higher doses of nattokinase also reported no adverse effects. People living in China have taken 540 milligrams 10,800 fibrinolytic units of nattokinase daily for a year, and adults living in the United States have taken 552 milligrams of nattokinase daily for 4 weeks without any reported adverse effects. Always consult a healthcare provider before starting any blood-affecting supplement, especially if you're on medications.